Many people find finishing cancer treatment one of the more stressful times in their cancer journey, and this is something not commonly talked about. There's the expectation that life should be just as it was before the diagnosis. And in this next video, we explore some of the issues that patients face as they move on from their treatment.
And the end of treatment can catch people by surprise because they don't necessarily think that they're going to feel that way. They often feel like they should be excited. Their family and friends and workmates are excited and they want to celebrate with them that treatment's finished. But often it's actually a really stressful time when they can feel quite vulnerable and scared and unsure and a bit lost of where they're going.
At the end of treatment, support often drops off a little bit, so you do lose the support from the medical team and the nursing team that you were regularly seeing week by week, and family and friends can also move on faster than you can, and they maybe expect you to be feeling better than you are.
I mean, often patients, families and friends put pressure on them in a way because they expect them to bounce back to the way they should be, have good energy, be back to the old person they were before they started treatment. And it's not often how it is for people. They're not the same person they were before the cancer experience, and they're often left with side effects that take time to recover from, and it's a new normal, what you go through, rather than possibly how you were before you started this whole process.
I think my main concern about finishing treatment was my family and close friends, because I think they worried about everything more than I did.
Recurrence is one of the biggest fears that patients experience when they've finished treatment. It can be their own fear of recurrence, but it can also be your family and your friends worrying for you that you might have a recurrence as well, which can obviously put a lot of stress and anxiety on you and as a family unit. I think if it becomes to the point where you're thinking about recurrence on a daily basis or it's overwhelming your thoughts, then you need to seek help, whether that's going to your GP initially or whether that's even calling your nurse specialist, and we can refer you to one of our psychologists who can give you strategies and support and help you manage those feelings.
There are lots of really good resources in the community, so there's counselling and psychologists. There are really good therapy groups and exercise programs, and all of these programs have been shown to help people recover psychologically.
It does change you. I think it changes a lot of people. Just live a little bit in the moment rather than worrying too far ahead. That works for me. It doesn't necessarily work for everybody. It really does depend. It is quite a personal thing. But for me, it was just to get on with things.